Welcome back to Taking Charge of My Cancer podcast, episode 72. It is a pleasure to have as a guest Kelsey Mora. Kelsey is a certified child life specialist and a licensed clinical professional counselor who specializes in supporting children and families impacted by medical illness, injury, and grief. She has extensive experience providing individual and group services to children who have a parent with cancer. Kelsey both guides parents and caregivers in how to best support their children, teens, as well as create unique opportunities to help youth make connections and increase coping and communication throughout cancer experience. Kelsey works in private practice, is the author of the DOT Method, an interactive tool to teach kids about cancer, and is the chief clinical officer of Pickles Group, a nonprofit that provides free support and resources to children and teens impacted by their parents' cancer. So Kelsey, thank you so much for being with me tonight.
Thank you for having me.
Absolutely. So do you want to just kind of tell me about your mission and what you're always planning on doing this?
It's a good question. Yes and no. I started planning to become a child life specialist when I was a teenager. So I went to college to become a child life specialist, and I worked in the pediatric hospital for almost a decade. But my professional career has taken a lot of different turns along the way. So I can't say that I expected to be also a counselor and a book author and working for Pickles Group when I started my career, but it's been a really exciting and rewarding journey for sure.
So how did you end up doing this? Like what made you go into this kind of like a specialty, like, dealing with either kids with cancer or children who has parents who have been going through cancer? Like what lead you into that?
Yeah. So I actually had a friend with cancer when I was in high school. So he died from leukemia, sadly, and I was in high school. So I started volunteering where he was treated, and that's how I learned about child life. So I knew I wanted to go into child life to work with kids impacted by illness and grief. And I would say that when I worked in the hospital, there was often there's always, gaps that you can fill. And I think some of those gaps that I noticed were a gap in support for kids who have a sick parent or a parent with cancer, and then also a gap in support after you leave the hospital. So that's what kind of led me into private practice, into my counseling degree, but then certainly what led to building Pickles Group with the three founding families who started the organization.
All right. Will you tell us a little bit about the Pickles Group? I'm super
Yeah.
I'm super excited to hear about this. I hear you in one of interlude podcasts. That's when I hear you for the first time, and I'm like, and I just literally, I think the afternoon, I sometimes I hear the podcast as I'm driving into work or leaving work, and that day I had a patient who have like a 3, a 5, and an 11-year-old with breast cancer, and she was struggling about how she was going to talk to the kids about it, and then literally, I saw her like at 1 o'clock, and I'm listening to this podcast, and you're on it, like around 5 o'clock, and I'm like, oh my God, listen. And so the next day, I told my patient, like, you need to listen to this podcast, and you can reach out to her. So I'm super excited to hear more about it.
Yeah, wow, that's quite a coincidence. Yeah, so Pickles Group was started by three founding families in the Chicago area. So all of the families had a parent with cancer and lots of young kids. And actually, one of the kids themselves said, I want to meet other kids who get what it's like to have a parent with cancer. And so they found me at the time as a private professional, and I started working with their families. So bringing the kids together, doing some activities, supporting them. And they just found it so meaningful and helpful that they wanted to create an organization that helped more kids find a community of other kids. And so it's called Pickles Group because the kids named it themselves. So now we have kids in our programs across the country and even the globe that are getting to meet other kids and gain some really valuable skills to deal with having a parent with cancer.
That's amazing. So how can, like how the people can find that? So they just kind of go online and look into Pickles Group and then just kind of join and then they do like a Zoom, or what do they do?
Yeah, we have a lot of different programs. So one program is so all of our programs are built on three main things. So honest and age appropriate information for kids, connection to peers, and then coping skills. So I provide webinars and content for parents who are asking, what do I tell my kids? And we have a free family support kit that can be requested by hospitals, by parents, that has tips in it for how to talk to kids about cancer. And then I do that as a webinar as well. So that's the resources for the parents. And then we have youth programming for kids in first through 12th grade. And those are virtual, that's a virtual 5-week program. It's called Connect Over Cancer. And I designed the curriculum and the kids go through the program. It's facilitated by volunteers. But then besides that, we also have a lot of other ways for kids and families to connect. We do community outings. We're piloting a new program where kids will be in small groups and get to meet with other kids more regularly.
That's so amazing. That really, you just never know. Like you going through this, you have a diagnosis with cancer, and then you're thinking and I'm a physical therapist, and I do oncology, and that's my specialty. And and then you hear the story for every patient, right? And everything is all about the patient himself in regarding, yes, you having breast cancer or head and neck cancer, or any kind of cancer, and this is the treatments that you're doing, and this is some of the secondary effects and all about the disease, right? And then few visits later, then it's like, okay, so how are the kids? So you have kids, and they start open more about, being so afraid to tell the kids. Like some parents tell the kids, some parents don't even tell the kids, and just
Mm-hmm.
try to really, I'm trying to advise them as much as I know about like what will be maybe the best way to involve that, or like, get a counselor and they can help you to talk to the kids better. But I always been into like your kids needs to know, no matter how old are they, you're gonna be using a different language
Mm-hmm.
depending on their age, but they need to know what you're going through. You need to go together as a family. You cannot be hiding it from them because they'll find out. So sometimes it's better to just be honest and then just be very transparent as much as you can. Is again, don't use to maybe a 60-year-old the word cancer, but maybe try to do some other type of language that can help with that. So what will be good resources that you will advise patients to look into?
Yeah. So I mean, Pickles Group has a ton of resources ourselves, like resources that we produce. So the webinar, the family support kit, but we also have a list of resources on our website. So picklesgroup.org is the website. And then if you go to other resources, we list a lot of children's books and some of our partners who do similar work. There are both national and local organizations. So we really want families to find what they need and what works for them. And so there are children's books. As I shared, I authored a workbook that, you said not knowing what language to use. So my workbook actually helps parents and kids to learn about cancer in a really gentle but friendly and honest way. So we talk about the cells in the body. So there's a lot of resources out there, children's books, organizations. We value a lot of our partners. Bright Spot Network has resources for younger kids or for parents to connect with one another virtually. There's Wonders and Worries has a helpline if a parent wants some more like individual guidance. Kesem has their sleepaway camp and other virtual offerings for kids. So we want kids to find and families to find what they need and what works for them. And so we amplify that on our website, and there's a lot of resources out there.
Great. What will be three valuable tips that you have that could benefit my audience?
I think the three valuable tips are really the tips that so there's two. I guess that's a great question. Let me think. So Pickles Group has the three main pillars of support. So we really believe that, and this is built off research from an article that was published in 2017 that shows that when kids are provided with honest information, coping skills, and a connection to peers, that they can thrive through a parent's cancer. And so those are three things that I think are really important, is to be honest with kids, to help them connect with other kids, and also to learn and practice coping skills. We know that coping skills are transferable to everyday life. So if they're working on coping skills, they can use them for any hard situation, including cancer. And then the 3 tips that we cover in like our webinar and in our family support kit are about sharing information, sharing expectations, and sharing feelings. And so I could definitely go into more detail about each of those, but really the overview is sharing honest information, sharing what to expect, what are some of the changes that might happen, and then sharing feelings, normalizing that it's okay to have a lot of different feelings about the cancer.
That's awesome. And then you mentioned something about your DOT method. Do you want to
Yeah.
tell me a little bit about that?
Sure. Yeah. So the dot method is something that I designed back in 2020, and it's officially published at the start of this year. So January 2024. It's available as a workbook now, and that's available on Amazon. I also sell it in like discounted bulk copies if like a hospital or a clinic wanted more to hand out to patients and families. But it's essentially an interactive workbook to teach kids about cancer. So every page the kids are prompted to draw or write. And through the cover to cover experience, they learn what cancer is, how treatment works. They talk about side effects. And then they also talk about emotions and coping. So it's really a comprehensive overview. It's good for really all ages. It's targeted towards like 4 through 12, but I have a how-to guide in there for adults about how to use it with different ages. And so I've had some parents reach out and say that they've used it with like 2-year-olds and have found a lot of success with the method.
And how can they find more about that method?
Yeah, so you can search the DOT method on Amazon. My professional website is childlifetherapist.com. I also have an Instagram, Child Life Therapist, that I share a lot of content on. So those are options. And the DOT method has its own Instagram as well. So lots of different ways to find it.
Right. And I will put those as well on the show notes so the audience can look into those more in detail. So I have another question. Do you have any experience how to manage if you come across any like children, kids, or even, young adults with disabilities, how to maybe manage that kind of like, anxiety or like, dealing like if they lost a parent or a grandparent from cancer?
Yeah, so I want to make sure I understand the question right. You're asking like how to support kids who have disabilities or are neurodivergent, like in the context of a parent with cancer.
Yes.
Yeah. Yeah, it's important. I mean, there are some best practices, but so much of these tips really do have to be modified for a child's development. And so I always tell parents and caregivers that, of course, they know their child best. And so for a child who maybe is developmentally different than their chronological age, you might be talking to them in simpler language. I think that's why the dot method is unique, is that it really can be modified and adjust. It's so simple that it's really good for a lot of different abilities. But certainly, if a kid is more hands-on creative, you're going to want to use those strategies. If a kid is more of a verbal processor, if they need simpler language, there is a cancer education book that is designed for autistic children. I'm blanking on the name right now. I can picture it, but that's a book for if kids are neurodivergent in that way and would benefit from a resource that's more written in the form of like a social story. It's all about tailoring the information and the resources to match every child's unique needs, both from development to their actual cancer experience.
Got you. What is a common question that you find some of that patients with cancer ask you, and will you share some of that information?
Yeah, I think a lot of parents worry that talking about it is going to do more harm than good. And I always say that, just because parents aren't talking about it doesn't mean that kids aren't thinking about it. And so if parents start talking about it, it sometimes gives kids permission and even a sense of relief that it's okay to talk about it. It's okay to ask questions. So I think it's really important that we don't assume that kids don't know or they don't understand, because they're curious and they're smart. And so I think once parents know that it can actually be relieving to talk about it. And it doesn't mean that's all you'll be talking about, but it might actually make your kids worried less. I think that can be really reassuring and helpful.
Okay, that's a great tip. You already mentioned a lot of books, so I'm not gonna ask. At least you want to mention any other books besides the ones that you have mentioned? Is any other good books out there for parents or for, like just kind of copying with it that will be helpful?
Yeah, there's like I said, we have a lot listed on the Pickles Group website. There are a lot of different resources. I think that there are different resources for different situations. So it's important to think about the type of cancer, the child's age, the family's race, religion, culture. Like all of those pieces can really play into what books are going to be the best fit for a family. So I think thinking more about that and finding books that match as close to your lived experience as possible is so important. But there is a lot out there. We try not to overwhelm families with too many options, but there's a handful on our website.
That's great. That's very good. Any podcast recommendations?
Oh, well, I've had the privilege of being invited on more podcasts lately, and I think a lot of those physicians and professionals are doing really interesting work. Of course, I do think that Dr. Toplinsky's Interlude podcast is a great one. I also listened to a really interesting podcast. The Onc Doc has his podcast, and he interviewed like three different women who are cancer survivors and thrivers, and that was a really interesting discussion. I can't remember the exact name of it, but it was three cancer survivors that he interviewed, which was really interesting. Um, yeah, I'm learning more about the podcast world. I bet you would have more suggestions than myself.
No, but I always like to learn like new things that I don't know. So it's like, yes, I want to know what they are so I can listen to it and learn. I have learned so much from them as well. I used to not do really into podcasts and I start to create this podcast and then I'm like it's really great. Like it's so many things out there. So I always ask my guests is like, what do you recommend? And I'm always kind of curious and see what and it's so much great information out there. So
Yeah, it's funny because I was never a podcaster like myself. I didn't listen to a lot of podcasts. I listened to a lot of music, and my husband listens to a lot of podcasts. And now that I'm being interviewed on more podcasts, I think I need to listen more. And there's a lot of people post about like child life podcasts, grief podcasts, cancer podcasts. So I think it depends on what people are in the mood for too, of course.
yeah, absolutely. Um, how come the audience can find a counselor or a psychologist to help them on their needs during and after cancer treatment? Do you have any suggestions? Like if they just, like besides go reach out to you, if it's any websites, anything out there in counseling that you feel can be a good advice for them?
Yeah, I mean, I wish that access to counselors and mental health support when navigating things like cancer was easier for patients. I think some larger cancer centers have built into programs, so obviously asking what resources exist within the healthcare team that you're being treated at, but also there are, like I said, some free nonprofit resources. So Pickles Group does not provide counseling or individual support, but we often refer families to like Gilda's Club or cancer support communities. A lot of different local areas have like cancer wellness type centers. So we try to find out who has those types of resources so we connect families. But we tend to refer to some of more of the national programs so that people can find places near them. Like I said, Wonders and Worries has a free helpline. So if parents are looking for more individualized or custom guidance for, how to talk to their individual kids, that could be a good resource. But it can be tricky. So I think looking to those nonprofits could be helpful first because sometimes insurance and cost and access can be a barrier. And you want someone who really understands cancer because that's maybe the reason why you're seeking the counseling.
Okay, perfect. Is any movies do you recommend for the audience?
Movies?
Yeah.
Oh, yeah, that's an interesting question. It's funny if we're like in terms of navigating parents and cancer. I do think a lot about the movie Stepmom.
Uh,
I don't know if you've seen that, but it's
I love that movie. Yeah, yeah.
yeah, I feel like I need to watch it again now that I'm like so far into this profession because I think going back and seeing the impact that these kids that impact that the situation has on these kids. I mean, the parents are separated, the mom is experiencing cancer, there's a step parent entering the dynamic, and I think you just see all the layers that and this is just obviously one family, it doesn't represent every family, but it's very and then she, becomes her prognosis is poor and there's an end of life component of like legacy building. So I don't know, that movie comes to mind.
Yeah, I
um
like that suggestion. That's very good. Um, Now, I want to ask you in the Pickles group, so we'll talk about parents who has been going through cancer and how to tell the kids to use well, have kids themselves who are been going through cancer.
so not at Pickles Group. Pickles Group is specifically kids of adult cancer patients, so their parent or primary caregiver guardian.
Okay.
um Professionally, I have worked with many kids who have cancer themselves or their siblings, but that's not Pickle Group's focus.
Okay. But you can help as well on that type of patients who are like kids who has been through cancer and now they're teenagers and having some of those secondary effects of the cancer. So you will be a good resource for them then.
Yeah, absolutely. I mean, I think my workbook is appropriate for any cancer relationship, and then I think a lot of the best practices are, similar to different like lived cancer experiences, regardless of who is the patient with cancer. I think a lot of the tips are that are recommended are the same.
Okay, great. That is one question you wish I would have asked you, and will you have answered it to wrap up?
Hmm. Let's see. Um, I think a question I would want the audience to hear about is like, is it bad for parents to be emotional or to cry or and things like that? I think a
Right.
lot of parents feel like, I have to be strong for my kids. They can't see me cry. And yeah, I want to debunk that myth a little bit because I think obviously parents and caregivers need to access their own support to take care of themselves, but it is really normal to have a range of emotions and feelings when navigating cancer. And that can give kids permission to know that it's okay for me to be sad sometimes too. So being strong can mean a lot of things. It does not have to mean, an absence of emotion. That's not really realistic when you're dealing with cancer.
That's a very great point. And you're right. I see that happen a lot. A lot of our patients really kind of like have that moment of like, I don't have the kids around, I can let go. And they can then become emotional here with us just because they don't have to be strong because the kids are not around. But that's a very great point. I think that you have to be vulnerable for everything, right? You have to kind of like, it's okay to cry, to express your emotions. It's okay for the kids to cry. I come across a lot of, I have a patient right now who has a teenage, I mean, she just turned 18 and it's just really going through a rough time. Uh, you know, what would be a good, nice piece of advice for that age where it's like, wow, my mom has, metastasis breast cancer and she's more likely going to die from this. How do you manage those? Because it's like, I'm 18, I can do whatever I want. It has been really hard for that age. Any tips?
Yeah, it's a tough age. I mean, I think it's really important for those older kids to still be able to preserve some aspects of, childhood and adolescence. I think having a parent with cancer when you're a teenager, it just kind of ages you and matures you so quickly. And I want to remind teenagers that they can still be kids and, have fun and do things that are important to them. And I think focusing on what you can control, I think it can be really overwhelming to feel like you have no control over what's happening. So really trying to focus on like what's within my control. I might not be able to change X, Y, and Z, but I can, focus on my mindset, or I can, do this to help, or I can do this to take care of myself. So I think focusing on what one can control, but also, taking care of yourself and doing things that are important to you.
That's great. Oh my God, such a great information, Kelsey. Thank you so much. I've really learned a lot. I'm super excited to share this info with the audience and the patients I see every day. So I have been looking forward to do this since we connect. So I really appreciate you doing this.
Of course, yeah. Thanks for inviting me. We're always happy to reach more families and people with this really important and valuable information.
Great. Awesome. Well, thank you again, and you have a great rest of the afternoon.
Thank you. You too.
Okay, bye.